Oh,
and we're still standing by. I'm waiting for my confirmation computer to kick in.
okay.
People are entering the room. It's a wonderful thing. Welcome everybody. We're just going to tread water for a few minutes here, and welcome you all to our webinar. I'm Sam Small. With me here is David Morin. You can wave, David. Say hello.
Good morning,
Hey.
everybody.
Hey. And we're here today to talk about the program in medical massage therapy, David Morin's Health Matters Seminars, the master class, a 5-month online course. And we really appreciate folks coming by to participate in this webinar. We're still allowing folks to enter the room, so it takes a few minutes to come in. But we'll just tread water. David, what do you think so far? We've gone through one course now of the master class online. Are you happy with the response that we've been getting, the feedback from the students?
I don't think happy can cover it. I think more thrilled, amazed and thrilled. My first online class after teaching so many years live, and it's a fascinating process to work with you and put this out there so that people from around the world can hear my voice as I'm speaking now and see the work that we've been doing for so many years, and put that out there to people that can really perhaps not have difficulty getting to a live class. It's a thrill.
Well, it really does make a big difference. I mean, the 100-hour program that you have been offering for years now required 12 days away from home. And that's a big chunk of time to be away from home. This online masterclass condenses that down so that the 100-hour package can be taken 5 months online using the website and all of the various tools that we have built into the website, and then just a 4-day hands-on workshop with you directly to round out the package. 72 hours online and another 28 hours as a live class. And that's just fantastic. 4 days instead of 12 days away from home.
And that's 12 days of class plus travel time. So
Yep.
that means a lot more. And it means a lot to me to add in these 4 days, these 28 hours. And I want you folks to know out there that when you get to that class of 28 hours, we'll not be doing lecture and introductions and a lot of talky talk. We'll get right to business. I'm going to demonstrate the techniques, and then you're going to practice them on your partner, and I'll be there with you to study with you and learn them and relearn them and answer your questions directly.
That's great. Oh, well, we've got some attendees here in the room, and just want to make a note that there's a chat there. You can type in questions if you have them, and we'll be happy to address those as we go along. Why don't we get focused in on medical massage therapy? How does that change someone's practice? I'm hearing from therapists that have been doing their work for years now, and they're kind of bored.
Well, I know exactly what you're saying, Sam. I went through it myself. I got bored. It was a couple, 2 or 3 years into a practice, and I got so bored with the mindless massage, listening to soft, relaxing music, Pachelbel canon or whatever, and the person would go to sleep, and that was a desired thing, that the person would go to sleep so that I could finish the massage, and it did get boring. I find that being a problem solver is so much more intellectually stimulating and frankly rewarding. I used to hear, that was a great massage. Now I hear, 4 visits with you have helped me more than 4 months of any other combination of therapy that I've ever done.
Wow, that's extraordinary. And what, in terms of what gets delivered to a client, what's different?
Well, the key is that, and I like to start each class, Sam, with defining for the folks, what is medical massage therapy and what makes it different, or is it different, or just what is it? And I want to say to everyone that, to me, the word medical massage therapy is an umbrella term to cover the scope of the skills that we bring to the session. We follow the clinical model, and the clinical model starts with a history, an evaluation, all kinds of work being done on the person, perhaps hydrotherapy, all kinds of things done, and then concluding with homework, self-care, things they need to be doing before their next session to have continuity and overall good results. Some have said, and actually it's been in writing, and I love to clarify this, some have said that medical massage is what's practiced in a doctor's office or in a hospital, or for the purposes of billing insurance only, or for the purposes of doing prescription work only. And while that may be true, for me, that is not the limiting aspect of the definition of the term medical massage therapy. It's an umbrella term, much like the term clinical massage therapy, much like the term orthopedic massage therapy, a term that implies that the person is providing more than a standard, wonderful, feel-good wellness or relaxation massage. So for me, medical massage therapy is an umbrella term to cover the skills that we bring to the session. We follow the clinical model, and we attempt in every step of the way to follow that clinical model by doing the history and the background check and evaluation and what's been going on with the client, and then charting a treatment plan and getting results based on their homework and their utilization of remedial exercise, hydrotherapy, and all manner of new coping skills.
How does, focusing and having this specialty in medical massage, how does that allow someone to interact with the medical community? What's the difference there?
A familiarity, an understanding of the terminology they use. We try in our manual and in our coursework to use as much medical terminology as we can without trying to confuse the person, of course, but to edify and educate them as to that form of terminology and that form of discussion. We orient folks to the proper way to report information to the physician or to the referring body. And we certainly encourage them to utilize those technical skills and those appropriate technical names when appropriate, when it needs to be done that way.
And there is, you review physiology and anatomy, but that's something that folks have gotten as part of their massage training in massage school.
I would think that everyone who's been to massage school, whether they're in a state that has a license or not, if they're a diploma or a licensed therapist, that they have had some anatomy and physiology. What we do in the classes, each one, and certainly in this program, is to review. We do an anatomical review. We hit the high spots. We don't cover every single aspect, but we certainly want to review muscles, ligaments, tendons, the major blood vessels, any contraindications, cautions, and things that they really need to be aware of, that we really need to be aware of as we're doing our treatment.
Contraindications, why is that important?
To me, anyone who calls himself a clinical therapist and ready to face perhaps difficult pathologies, difficult situations coming in, I think it's imperative that even a regular wellness massage therapist have a good working knowledge of what the absolute contraindications are, and then also where to be cautious. There's a difference between a contraindication, which says don't do it, and a caution, which says proceed with caution.
So this clinical approach really does separate people from the typical massage therapy practice where somebody comes in and perhaps there's not even much of a dialogue. It's, how are you? They get on the table, you oil them up, and away you go, and the music takes over in the room. This clinical approach really does bring the therapist into a role as a professional healer. Is that an okay word to use?
Not for me. I use the word healer. I think we're all healers. I think we're healing each other at any time that we're doing any kind of interaction, professional or personal, with another. I don't use the term healer in my practice. I use the term therapist, and I let the people say what they will about the work when they've received it, but I don't use the word healing and I don't use the word healer. I use the word therapist, and I'm proud to do so. I've always included the word therapy when I say the word massage. I've been doing that for 37 years because I truly believe with every ounce of my being that everything that we do, if it's done properly, is therapeutic and can lead to some beneficial result, whether it's light work, deep work, clinical work, whether we know the anatomy or not. There's a lot of good work being done out there where folks may not know the anatomy, but they have excellent hands and an excellent approach, and they get good results.
One of the things that it seems so different to me about what you do and what you teach in this clinical approach is the clothes on model. No oil, clothes on.
Well, that came about from my own situation. Being a male therapist in a female-dominated world, we generally say that 2/3 of the therapists are female and 2/3 of the clients are female. So here I am, a male therapist in a female-dominated world. And it just came clear to me after going to 2 Olympics and traveling for 8 years with my alma mater university track and field team, where I was working on young athletes in a hotel room, maybe late at night, at 10 o'clock at night, have half a dozen athletes in my room getting ready for treatment, either in the hotel room or on the training track. They're not going to be taking off their warm-ups for their massage, whether it's a little warm-up before the exercise, before their drills, or even after a session, after a workout session. So the clothes-on approach came about, and I began working clothes-on with them, and then I just translated it into my practice. And it was a little difficult when I did integrate it into my practice. Folks get used to that clothes-off oil massage. And what I did was to just start using the clothes-on approach with new clients. And it became rather easy to orient them, and they fell into the habit very nicely, I will say. Both my male clients and female clients liked the idea of having a pair of sweatpants or a pair of yoga pants and a loose-fitting cotton t-shirt on to receive their therapy. It eliminates those gender issues, those modesty issues that we as massage therapists have unfortunately had to deal with far too often. And for me, it just cleared the air. I found that my clients liked it better. I certainly liked it better. It protected my modesty, protected their modesty, and along with that, less oil, better on the sheets, better on the linens, no sliding around on the body. My comment is that if you don't want to go deep, then put oils all over something and start sliding around on it, and you won't be able to go real deep. Not like you can with a thumb saver or with a forearm or hands going through a cotton t-shirt. So that's been about 20 years ago for me now, and it has worked out wonderfully well. My clients love it, elderlies, young people. It's just amazing how responsive and how good the response has been in this respect. And it happens with other people too. I've had so many people tell me, I just don't know how I would integrate that in my practice. My people complain, they don't want to do that. Well, that's what they say. The truth is that if you integrate it and you're delivering incredibly good work, then it'll go over smoothly.
Well, I have to say I was really amazed and impressed in making the videos with you, and really seeing you do the work clothes on, the body positions that you are able to comfortably put your client in were remarkable, because you just can't do that with somebody when they are naked. Unless they've got their clothes on, you can't spread their legs, and you can't work around their intimate areas the way that you're able to do when they are clothed. It is a remarkable difference, that clinical approach.
Yeah, it only has to happen once or twice that say a starched linen service sheet would somehow find its way just to go away from the client, just to fall off the client. And it's happened. It's happened to me, and I'm sure it's happened to folks in our audience today. And it's not very pleasant when it happens, because it's difficult sometimes, I would think, at least I felt it so in my case, to say, that was an accident. Excuse me, I didn't know that sheet fell off. It certainly affects the sideline position, which we use to an incredible degree. And it affects all positions. We can do table stretches. We can have the person get up and walk around the table to see how that leg or that hip or that side is as they step, and then get back on the table. It just opens up so much. And after all, Think of all the therapy that's done on a daily basis with athletes on the track, at the field, in the clinic, all athletic trainers and physical therapists, and so many people doing work clothes on. It just doesn't mean that we have to make a muscle, we have to get to the skin to get through to a muscle. There's just, my comment is that the muscle doesn't know or care whether it's being covered right now with a t-shirt. The muscle cares and wants to know that you're able to get to it and do the treatment that it needs.
Talk a little bit more about the side lying position and what's so unique and special about that.
Well, just as you said, it's difficult to put a person into a position to work without clothes, unless they do have clothes on. And in the side-lying position, this opens up so much treatment. In each course that we cover, we always include a substantial side-lying piece of work, so that when we integrate from the 1 course, 2 course, 3, 4, and 5, we have a complete treatment that we can do in the side-lying position. We can work on both sides very effectively by having them turn over. It gives us an opportunity to approach areas that we don't get to approach very well. Number one, for instance, the side of the neck. You can approach the neck very well. You can approach the shoulder extremely well, have ultimate movement in the shoulder. Very great access to the abdomen, to the thorax, to the complete side of the body, where breast tissue will lean away from the area you're working. On the hips, so easy to get into the gluteus medius and maximus and minimus, all along the side lying there and all down the iliotibial band, calf, feet. It's just an incredible approach to be able to work so thoroughly and be able to do table stretches, twisting and moving and blending and all of the things that we like to be able to do on the table. It's very liberating.
What else is different about the clothes on?
Well, I mentioned modesty issues. I mentioned the elderly folks who anyone who's been doing massage for a while will appreciate that how many grandmas you've had in there in your room and you're waiting for them to come out after putting their clothes on after your wonderful massage. They get so spaced out. And 15 minutes later, you're still waiting for them to come out with their clothes on. If that's ever happened to you, and I'll bet it has, I know it's happened to me quite a few times, it certainly speeds up the efficiency of getting folks into the office and getting to work on them and then asking them or having them leave so the next person can come in and be there. So that's a real big plus. I would think that those three are the three that come to mind. Modesty issues, ease of working, thoroughness of working, time efficiency as well. So those are the things that come to mind right away. Certainly saving on linens, not so much washing, not having to buy oil, other little smaller considerations such as that are there as well.
I'm going to post, I think I'm posting a question from Lola that relates just to what you just saying. Okay. She's asking that, mentioning that she has a primarily geriatric practice. And she's asking, will these techniques be adaptable to that population?
Absolutely. In fact, it is the geriatric population that was so appreciative and so receptive when I started integrating the work that I'd been doing with the track and field team, traveling with them. I brought that same approach of treatment, not only the close-on approach, but the approach of treatment as well, the techniques. And all I had to do is loosen or lighten the pressure. And my geriatrics loved it and love it. And after all, doesn't everybody have primarily a geriatric practice? There are 65 million people, I just read, I believe, this morning, over the age of 60. It's just an aging population is what we have. And I'm telling you that elderlies appreciate the ability to walk into your office wearing a pair of sweats or a long pair of shorts and a t-shirt and get on the table. They like that. So many, and that's another benefit of close-on that I didn't mention. Sam, you asked me a question, what else is good about close-on? And I answered partly. There's another major component, and that is, as massage therapists, we notice that our clients are getting bigger and bigger and bigger. And the sideline position and the close-on approach really makes that so much easier to work with. Number one, a large person may be very sensitive about their body. Being seen, being overweight is not pleasant to someone who is concerned about their self-image. So that becomes a plus as well. And then the amount, if you've ever tried to take oil and put it over a huge person, then you know that it takes time to spread all that oil around and then get the work done. It just makes it slower and more slow going, we'll say. So the close-on approach facilitates that, and geriatrics like that. Whether male or female geriatrics, they will go along with that very, very nicely. They have done so in my practice and in so many practices over the last 15 years of teaching these classes.
There also the sideline position I've seen, in your demonstrations, that when you are using the sideline position, your physical posture is better.
Yes, yes. In my case, I use a seated position quite a bit. I believe that we all need to have a rolling stool for when we need to sit down and do some sustained work in a certain area, say the neck or any area of the body. So I use a seated position quite a bit, and yet standing or seated, I find that I can really use that sideline position very, very well. And it helps me a lot in delivering really good therapy in an economical manner and an economical time frame as well.
And the clothes-on combination allows the use of the hand tools that you've developed?
Yes, another factor of this course is that I studied neuromuscular therapy with Paul St. John way years ago, and he was a student of and affiliated with Dr. Raymond Nimmo, N-I-M-M-O, of Palmer Chiropractic, who came up with the little tools that are used, the hand tools that are used to work in the lamina groove and other areas around the body. So what I've done with what we call L-bars now, we've adapted them, we've modified them, I've changed them to make them more ergonomic, easier to hold in the hand, easier to develop and deliver really good, sustained pressure on a consistent basis. So the Nimmo work is an aspect of this program that I've brought in from my training with the Dr. Nimmo work way back from the 60s and the 70s. So I integrate that in, and I've changed the T-bars that he had into L-bars, and we now call the padded one the thumb saver, and we use the beveled L-bar as well for working in the lamina groove and softening the tissues in the lamina groove. These several layers of muscle in the lamina groove are very responsive when we're able to get in there. And that's what Dr. Nimmo was all about, getting into the lamina groove back as early as 1957. So I'm bringing that and keeping that classic approach, one of many, many techniques that we will use in this course. Another thing that I like to say is that I'm not a clone of any one particular approach. Yes, I've studied neuromuscular therapy, studied many approaches to work. So you'll find that I'll be bringing in coursework from a great variety of sources, whether it be joint mobilization or pin and stretch or muscle energy technique, myofascial work, all down the line. So I like to have a very broad and comprehensive approach.
There's a question from Robin that I'm posting here, I think. And she's asking that can these techniques be adapted for people in a wheelchair?
Absolutely. What we're talking about, we're not talking about a number of techniques that were designed specifically by me to treat only people in my office who are not wearing clothes. The techniques I'm using cover classic massage therapy treatments as well, whether it's a petrissage type of move or an effleurage type of move. Absolutely. The variance, of course, is in the pressure. If I have a 20-year-old athlete in my office or in a chair, wherever they are, then I'm going to be able to use pressure that I chances are would not be able to use with a person that's, say, my age at 73. So that's the variation, by the way. The amount of pressure that we would use would change. And that's what I had to do when I came back from the working with young track and field athletes to working in my geriatric practice. Change the pressure and everything else changes as well.
Well, and that dovetails into this question from Felicia, who asks that can these techniques be used on pediatric clients? And I guess
Absolutely.
that's really all about the pressure.
Absolutely. There is no question, because we're not talking about a technique that is automatically deep. And by the way, another comment that I always like to make it clear, medical massage therapy is not a technique. Let's be clear about that. Medical massage therapy is not a technique. It's a combination, in my case, of everything that I've studied, everything that I've learned, and everything that I've practiced over the years and gotten good results with. So I want to be very clear on that.
I've also seen you, coach your students on establishing a very intimate and detailed communication protocol with their clients on the table.
Well, intimate in the sense that I want their feedback. I say to my clients that my feedback, my sensitivity, my intuition is good. It's not perfect. And I need that feedback. And I've found it very, very helpful over the years to give my client the veto power over the pressure. I really believe that we are missing the boat if we don't do that, and we're gaining tremendous impact if we do. What I've experienced is that when a client has the ability to say, in my case, I use a scale of numbers 1, 2, 3. 1 is you'd like more pressure. If you can get it, you'd like more pressure. 2 means it's just perfect. 3, back off a little, please. So that's how I integrate and have that close communication with the client as to the amount of pressure that they can comfortably handle. We need to remember always that the client is the nervous system. Always, always, always the nervous system. Everything we do in a session is designed to have one effect, ultimately, and that is to slow down the nervous system. So if we're using deep pressure and the client is gasping or using white knuckles on the table and oh, like that, then they're not relaxing. I've said to a person, anything you can breathe into and relax into, I can do. So I'm not a proponent, clearly not a proponent of it's deep and get used to it, and it's got to be painful before you get better. So just grin and bear it, and here I go. I'm going to use all the pressure I want to, and I don't want to hear anything from you. I don't think that's a good approach, and I don't use that approach, and I don't teach that approach. I love to give the client, be it a small elderly lady who's looking at this large man going to be digging into her leg or her muscles in her arm, and to know that she can say the word 3, and I instantly back off. That is empowering, and I have found it to be very, very highly rated by my clients. They also tell me that you wouldn't believe, David, I went to this person or that person and I said, please, it's hurting, let up. And they didn't let up. They said, oh, well, you've got to have a little pain before it gets better. And they just laughed it off and kept going. I don't think that's the way to go. I really don't.
I've had I'm a big guy, and I've had massage therapists that work on me pretty deeply, and I've noticed if it's too deep and the pain is too sharp and pressured, I tense up. It just ruins the whole sensory experience.
Exactly. And couple that with a person who is maybe not as assertive, or at least as openly talkative as you would be, I would imagine, becomes, excuse me, you're hurting me, back off. How many people are there who have laid on the table in an disadvantaged position and not felt comfortable in saying, that's really hurting me a lot. Could you use less or something? So many people are not able to say anything. And if they do say anything, it's very discreet. It's very sheepish. It's very light and says, could you ease up a little? And the therapist may not answer that, may not respond. I don't think that's the way to go. In fact, I believe in the approach that any tendency of the client to pull away, to resist, to even make a face means that the therapist needs to slow down, back off, or stop. I really believe that. And when I started doing that more and more, I'm a big guy and big, strong hands, and I was always the one that they sent the big ones to, whether it be male or female. The big, strong ones, they came to me because I was the one known for the deep pressure, the big guy. And when I changed, I've had people tell me who've known me for 20, 30 years and say, David, your treatments are better than ever because you're not using that deep pressure that you used to just dig in there, and I had to respond by moving away. So I've had plenty of people move away from my treatment as well. And it's that taught me to work with the client, give them the veto power over the pressure, let them say that it's just right. And then we can proceed and they can relax and we can really get a dynamic result for them.
Well, you know, I do also, one of the benefits of working with you, David, is that you do work on me. I've had 4 neck surgeries, and, you know, I'm lucky to be, you know, not living my life in a wheelchair. I get muscle spasms and, you know, trigger points galore. And I truly, you know, I mean, it's one of the reasons that I was excited and interested in doing this work to help, you know, document and get your work out there to the public more, is because I have a direct experience of it. You give a massage that is like no other that I've ever received.
Well, that's what my students hear as well, just from practicing the techniques that I've put together. And I'm really honored that you would have that response. Certainly I'm honored when anyone does. And it confirms for me that I'm in the right place, that I've chosen the right profession, thankfully, and that 37 years in, I'm starting to get the hang of it. And I think I'm going to figure a few things out before I'm done.
Well, one of the things that you've figured out, obviously, are these hand tools, the thumb savers, and an ability to be able to use a hand tool, but in that fineness of the positioning, to be able to have your fingers and work that whole system around the tool to really feel what's going on.
There's a special way to use it, and I've had lots of people, or lots of students over the years, therapists say, oh, well, I wouldn't use a tool because I can't feel through that. I have to use my hands. I would beg to disagree. In fact, I have lots of cases of students saying that I would never use a tool because I don't think I could feel, or I'm hesitant to use one. And I've had many testimonials from students who say, you know what? After using that thumb saver for a while and saving my thumbs and using it on larger, more strong, more developed people, I have been able to help my thumbs and deliver sustained pressure better than I ever have before. And I'm now starting to feel through the instrument. And you're right. How we hold the instrument, how we hold it, how we position our fingers around it dictates what we're going to get. And if we have 3 sensors there to our brain to give our brain information, we will get information to our brain.
What is it with the thumbs in you know, if I'm giving massage, you know, for a number of hours a week, why do the thumbs wear out so quickly?
In my case, and I suspect in many others, it's not just the direct pressure of the thumb. It's not just the placing of the thumb and pushing with it, but rather it's all of the turning and the twisting of the hand and delivering pressure up in that manner, or turning and pushing in unusual positions. That's what I think happened to me. I was strong enough to where I could let my strength carry me, and I didn't work on finesse enough in the sense of my early career. And I believe that that's what did me in, as it were. What I find now with the thumb saver is that I'm able to deliver a sustained pressure. And by the way, clients, unless they see you pick up the thumb saver, they cannot tell the difference between your thumb and the thumb saver. You can switch back and forth, and they will not be able to tell unless they hear it clanking on the desk when you put it down.
Great. I do want to spend some time talking about the actual class, the online class. We can move on to that. If there's other things that you want to say before we do that, David, about the clinical approach and about the specific package of techniques and skills that you have that you are offering through this course.
I'll make a couple of comments, Sam, before we move on to that. One, I'd like to say that this program, we like to say that it's evidence-based, results-oriented, and client-centered. That package is what we ascribe to, what we aspire to provide. We want to go with things that have worked, things that have understood to have some rationale behind them. We want to work with getting results, and we're not interested in just the filling out of a time scale or time frame with a foo-foo wellness type of massage. Rather, we want to get results in every case, use the session very productively to show the client some exercises, to use hydrotherapy, to bring those clinical approaches into our session as well. And we certainly want to accentuate the variety of the techniques in this program. Perhaps I could illustrate this by saying, by indicating a call that I had some time back from a therapist who said, David, I'm 62 years old. I've had 27 years experience. Why should I take your class? What am I going to learn? And my comment, and I had to think a minute, frankly, because that was such a startling question. It put me on the spot. And I thought a moment, and I responded this way in saying that, well, any good class that you take with a good instructor, the anatomical review, the assessments, the discussion of pathologies, even the remedial exercises, and perhaps the hydrotherapy, may be all the same. We're all reading the same authors. We're all studying the same anatomy books. We've all learned that the latissimus dorsi is the latissimus dorsi in any language. That's what it is. So that'll be very similar. What differentiates this course from others is the close-on approach, the use of the tools, the thumb saver, and certainly the techniques. I've been a therapist for 37 years, and I've been privileged to work in a variety of environments and a variety of situations, learning. I've attended lots of courses and studied with lots of teachers and assisted several teachers in presenting their programs. So the collection that I've made over 37 years, and I said to this particular person, and I say to everyone in our audience today, if you are a collector and you value collecting good things, then you cannot resist coming to see my collection. Because what I've been doing for 37 years is every approach that really worked well, I've integrated it into my work. So that's why the work that I'm doing is not because I'm so bright or anything, just because I have the good sense to recognize a good thing when I've seen it and have the sense to put it in my collection. I'll claim that kind of brightness, but that's about it in terms of just having the wherewithal to put it into my collection and use it. So that's been my difference, is that I've used everything good that I've learned and continue to get success with it. And you will too.
Well,
the last comment that I would like to make, Sam, is
please.
that one comment about the approach that we take in terms of education. I've mentioned Juanita's name a couple of times. I would like to say something about my partner in teaching. We met at Massage Therapy School 37 years ago. She's on the broadcast today, and she co-teaches with me, has helped me in the manuals, compiling the manuals and going over them, improving them, has enhanced this program dramatically. And we each have 37 years of experience. So together, on the two prime teachers that you'll be interfacing with in this program, whether it's online or live, your two teachers will have 75 or even 80 years experience. She's being a nurse of 8 years experience before becoming a massage therapist. And our teaching staff of several fine therapists who have joined us in assisting and presenting with us. Together, you might add up and say that we have about 150 or 160 years of combined experience. So that's a lot going for us when we're interfacing with you and your questions and your interest in learning more technique.
Yes, and we do so appreciate Juanita's participation. In fact, she just posted a note here to remind us that we really haven't spoken much about the assessment protocols.
Aha. That's true. And yes, how does that add to our program? The ability to understand what the athletic trainers and physical therapists are using in the terms of standard testing, the approach to physical assessment, enhances our approach tremendously. If we can learn just even the active range of motion, passive range of motion, manual resistive test, and some of the special tests, we can learn a whole lot about how we can be more beneficial to our client, and we can also learn when we need to refer. There will be occasions where we need to refer immediately or right away without even treating a person. So to me, a clinical massage therapist needs to know the anatomy that they're working on thoroughly, and whatever contraindications there may be to that, and also how to evaluate before we touch. And by the way, thank you, Juanita, for mentioning that, because what I found in integrating years ago now, the assessment work into my program, into my work at the table, it legitimized and made it so much easier to establish a more professional rapport than before. Because as you suggested earlier in the broadcast, it's a matter often of, hello, Mr. Jones, I'll wash my hands, lay down on the table, I'll be right back, and we get started. Now it's a matter of, come in, I look at your history, I see how long, when did it start? When is it the worst? Is it dull? Is it sharp? Questions like that. And then we begin saying to the person, okay, stand over here, please, and follow me in the movements. I'm going to take you through the active range of motion of the shoulder, knee, ankle, whatever area we're working with, and might use passive resistance, might use manual resistive test, and we might use some of the special tests that apply to each area of the body. So the assessment work is incredibly valuable and in our scope of practice, so we can integrate some of that work into our practice and help so many more people. Thank you, Juanita, again for bringing that up. That needs to be said. And I'm looking for more questions from people who want to hear things that they have been wondering about as well.
I want to just take a minute and play a little bit of the demonstration, one of the demonstrations that we have. There, it's a 5-month online course. Each month you get access to 5 or 6 hours of video content, and a lot of that is a demonstration of the work. And I'm going to play a little bit of that for you now, so that you can see some of what you'll experience in the course. And this system allows me to do that, hopefully. Well, I think that shows you, a bit about everything that we've been talking about, the close-on position, how that resolves intimacy issues, and allows you as a therapist to approach, your patient's, your client's anatomy in a way that protects their modesty, that does a tremendous amount of beneficial work for people.
The ease of reaching the gluteal area, Sam, that you showed in that video there is one of the paramount things, because so many times when a client is draped or underneath a stiff, perhaps, sheet, it's not too easy to work through that sheet, and we don't generally like to go under the sheet to do work. So it just opens up the ease of access all around the all-important pelvis, so many muscles in the pelvic area.
Great. I'd like to take people through a little bit of the website, and
Sure.
it'll take me a second to cue that up.
Okay.
But I think it's worthy of taking a look at. And I think that I may be doing that now. Yeah, sure. So here is, this is a peek inside of the Health Matters Seminars teaching website. This is a membership website that your course allows you to have access to for a year and a half. It takes 5 months to go through the structured program. Each month we have a different focus we move through. We start with cervical spine, upper extremity, thoracic spine and torso, lumbar spine, and then lower extremity. We also begin from the very beginning, the documentation. You have access to, in the first month, you have access to the cervical spine, and you have access to the documentation, because the documentation applies to all 5 of the body areas. And within each one of these focuses, each month you have demonstration videos broken down into different areas and different focuses. The physical assessments, the treatment in the side-lying position. David takes you through, similar to the videos that we just saw. That's part of that series. There's also presentations that David makes. A functional anatomy review is a part of each of the sections. We go through a review of the appropriate techniques, the pathologies, contraindications, and those are typical for each one of the areas. Each month, the group will work on this particular focus, and then as a group we'll move on in the second month to upper extremities and go through the same sort of content for the upper extremities. And then we have tests. There's a test for each one of the sections. There are 40 questions to be asked for you to answer. 70% standard is a passing grade. Juanita has done just a fabulous job in constructing these tests to assist you, to drive you through the entire workbook and the videos as a way to check your progress and to check that you're getting it. The combination of the online masterclass with the 4-hour direct hands-on program that you can take in a number of different locations around the country, 4 days, really rounds out the entire package and allows us to offer the certification. The online masterclass by itself will earn you a certificate of achievement, NCBTMB certificate of achievement. And that is also a valuable thing and a very nice thing that you'll get to put on your wall. We have a chat. I'll bring you to that as well. And this is an opportunity for 24/7 for you to be able to ask questions of David and the staff. Juanita is on here regularly. David is on here regularly, asking a whole variety of questions about the specific coursework that's being covered that month, and other issues that maybe. I'm here quite a lot answering technical questions and helping people with the videos you can access. The videos, by the way, are online and streamable, but you can also download them at your convenience and bring that into your computer so that it's hosted at home. You don't have to be online. You can download these videos and keep them as your own personal library. We have the program structured in a 5-month package, asking people to work 5 hours a week in studying the work.
At least 5 hours a week.
At least 5 hours a week in studying the work and viewing the videos and viewing the course manuals. There's a tremendous amount of content in the course manuals. You can complete the entire online package in 5 months, but you don't have to. It's one of the nice things about this course is that it does give people the opportunity to work in their own pace and continue on doing what's right for you. You have a full 18 months that you can work on this and take your tests and complete the work. It's a really, David, it's a really impressive package. It took us years to put this together, to film all the video and to structure an educational package that makes sense and does the job, adequately replacing those 12 full days of in-class work plus travel. I'm looking at some of the questions. David, what are your thoughts? I mean, you know, we started talking about the feedback that we've been getting from the students who've taken this course.
I've been thrilled at the feedback, even without the hands-on class that's coming up in April for these folks who are now in training with the online work. They have been practicing. They say that the course is well laid out. The words are, generally speaking, that they have found the information to be very valuable, that they're integrating it into their practice, and they're getting feedback from their clients that we've been predicting they would, that the clients are appreciating the approach, and no one's ever done that. The two common things that graduates of this program hear from their clients are the same things that I hear, and that is, I've been having massage a long time in lots of places around the world, and nobody's ever done that. Generally, they're speaking about the close-on approach, the use of forearm, the use of specific work, and the getting to the problems that they have in ways that they have not encountered before. And the second thing is that they always hear from folks, and that is that rather than hearing that that was a terrific massage, they'll hear things like, several visits with you have helped me more than anything I've ever done for my condition, for my problem. And there's also the reality, Sam, that there are a lot of people walking around, just look at them in the mall or at the beach or wherever you are, that are walking around with old injuries, old whiplash injuries, old neck injuries, old back injuries, old leg injuries, and they're generally feeling like they can't be helped, because they've been told by their physician quite often maybe that there might not be anything for them except medication or surgery if they want it. What I've found in being a therapist of this type for so many years is that so many people have been helped either to avoid surgery or to make the surgery that they did have better with the post-surgical treatment that we're able to provide. So it's been incredibly rewarding. It has been, and it is, and it will continue to be incredibly rewarding to me, more so than to be told that I was giving a really good massage. It's just a whole level different in terms of response.
Great. I want to just spend a few minutes again talking about the course. You are able to access this material in two different ways. If you are just available for the online course, you can do the 72 CE hour online course only and receive a certificate of achievement, NCB TMB approved, which can satisfy some of your requirements for continuing your licensing. Every state is different. You do need to check. Some of them have limits on the number of hours that they will allow you to apply in online courses. If you so choose as well, you can continue on for our full 100 CE hour certification by adding the 28 hours, 4 days of contact class, hands-on techniques with David. David will demonstrate in the room, and then you will have the rest of the time to team up and practice on one another. David will stroll around and offer coaching and remediation on the techniques and how you are using the skills. Those courses, the 4-day courses, currently we have scheduled, and we will probably be adding to this, but currently we have scheduled in Los Angeles, Dallas. We have a course that we just added in Maui, Baltimore, Maryland, and Fort Wayne, Indiana. We have a whole cluster of students from Fort Wayne, Indiana that are taking the course this time, and we've scheduled a class to be convenient for them. As we bring new students into the course this second time, the course that starts November 6th, we will make a determination on where those people live and structure the class schedule so that it is most convenient for the students that are taking our class. This 4-day hands-on contact class is only available to students who have taken the online master class. It's the hands-on component of the master class. Certainly the material is covered in the videos and the demonstrations that are delivered on the website through the course of the 5-month class. But this is an opportunity for David to work with you hands-on and to observe and evaluate how you're getting it, and to assist you to make sure that you're getting the work correctly, applying the skills and techniques appropriately, and that's what allows us to give our Health Matters Seminars certification in medical massage therapy. Both ways that you may take the course does allow you to get a certificate suitable for framing. As a professional, that's a very important thing to be able to put on your wall, and we welcome the opportunity to deliver that to you. We have, as a special, one of the things that we wanted to offer you, the folks that are taking this webinar, we will send you a link. We had a series of early bird discounts, and those have expired. We've moved on past that. The course is just starting in a little over a week, November 6th. So the early bird has flown the coop. But we did want to offer the folks that are taking this webinar specifically an opportunity to have a discount. So we will send you to a link that via email. We'll send you a link to this page. It's not a public page, and we'll ask you not to share it with the public. This is specifically for you, the participants here in this webinar. And this allows you to, it's roughly around a 10% discount. We've got several different payment options. The online masterclass you can purchase with a single purchase. You can choose 6 monthly payments roughly coinciding with the duration of the course. And you will receive your certificate at the end of the course when you finish your tests and your final payment is made. But we also wanted to be sensitive to people that whose cash flow is a little bit tighter, and so we came up with a 12-month payment plan for your tuition package. And that brings the monthly payments down to $115. That's less than, you know, the one massage. So for just the cost of a single massage that you can give, you can enhance your career and expand your earning potential with medical massage therapy. The only thing with the extended payment plan, since it goes beyond the scope of the 5-month class, is that we will hold back your certificate until the payments are made in full. So take the class, take your tests, attend the 4-day course if you want, but only until the payment plan is complete will you actually get your certificate. We think that's fair. It keeps people in the game. It keeps them consistent with their commitment. The professional certification package has a discount built into it. You get an additional discount for this webinar. So that's really a 20% discount overall. The package of the masterclass online with the 4-day contact class is priced so that you do get a 10% discount as a package. Additional 10% is being offered then right now with this webinar discount. And this webinar discount for you folks is in effect until this Sunday. It'll end Sunday night. There's also a 6-month program for the package and a 13-month program, again with the delayed certificate, that brings the monthly payments down to $151. And we think that that's approachable for you know, pretty much anybody to be able to participate in this coursework. We want as many people as can join us as possible, because there really is so much benefit to be had by bringing this work into your practice. I'm going to come back to here I am, and I'm going to come back to David. What else, David? What else do you want to, as we begin to wrap up our webinar?
I would say, Sam, that to anyone who is in clinical practice or anyone who wants to be in clinical practice, that this is a program that they will gain a lot of information from, that they can put to work right at the table. We're not talking about theories. We're not just going to sit around and discuss things. We're going to get it done, because that's what we do. This is a treatment, an approach of therapy, and we're going to do therapy, and we're going to do good therapy, and we're going to get responses that we haven't gotten before. So if folks are interested in getting those kinds of results and having a practice that's based on a clinical basis and get referrals from referring bodies, physicians, and others, then this is the program that they want to be looking at. And I further am so grateful for anyone who's taken the time out of a busy day to sit in with us and listen to what we're having to say and respond with questions. Do you have any more questions there that we can look at? Or
well, yeah, there is. I just wanted to make note that I've posted a link to the registration with a discount. I meant to put that up as I was talking about it. You should be able to see that register now button. If you click on that, it'll take you to the page that I was showing you with the webinar discount that's only available until Sunday. Some of the questions that have been coming in are about the availability of your coursework outside the old way of delivering it, the 12-day courses, and what kind of class schedule might there be for 2016. It's been more and more difficult to deliver the course, the entire 12-day course, in a variety of locations. It's harder and harder for people to travel. Quite frankly, one of the reasons that drove us to wanting to have this online option is that attendance in the contact classes in various different cities has been declining steadily over the past couple of years. It's harder and harder for people to travel to get away. I know some people still want that, and I assume that we'll come up with something of a schedule, but we only approached, you've been delivering this as an in-class package only in 8 Western states. It has not been a national program.
Correct.
It's the online package that allows us to bring this to so many different massage therapists around the country and around the world. We have students that have registered from Great Britain, and we've got a great interest from students in Brazil, in Israel,
Canada.
and Canada,
Australia, New Zealand.
Australia. There's a whole bunch of students that are asking us to come and deliver a 4-day class in Australia. So folks that are interested in taking the coursework in their, specific locations, we're going to do our best to, expand the number of locations that we offer the 4-day class in. But it does require travel. It does require David, to hit the road, and that it just gets harder and harder to do. It will be driven by the locations of the students that register,
right?
Because that makes the most sense.
We're out to serve them for sure.
Yeah. So we appreciate the interest and the questions of being able to go to Seattle or to South Carolina or. But it's getting difficult, and we encourage you to accept the online version of the course, and help us consolidate and deliver this to as many people as possible. That being said, your home location, David, you are relocating back to Maui.
Yes.
And that will give an opportunity for you to deliver an intensive, you've done those successfully, to deliver an intensive workshop where we cover all 6 courses in the period of 2 weeks. 2 days on, 2 days, and then a day off, and then another 2 days of class and a day off. And those will quite likely be happening again on Maui and perhaps also on Oahu.
Most definitely. Perhaps on Oahu, definitely on Maui. As I'm moving back to Maui December 1st, after 6 months away, I moved to New Mexico to sell my place here in Ruidoso, New Mexico, and that looks like it's happening nicely, and I'll be leaving December the 1st to relocate to Maui permanently, as that's where Sam is, by the way, so we can work together quite a bit easier if I'm there on the same island as he, and we can do filming and all kinds of things there. So I'm thrilled to be back, and yes, I've taught intensives on Maui and will do so again. I look forward to traveling to Oahu and the other islands, Kauai and the Big Island, to bring classes there. I can't promise how extensive the online class schedule, the live class schedule will be for next year, given that we're doing numerous classes around the country with this 4-day program to supplement the online training.
Right. Okay, well, I think that wraps us up. We've gone over a little bit over an hour. We want to thank you so much for participating in this webinar. We covered a lot of territory because there is so much to this work. It is, as David said, medical massage therapy is not just a single technique. It's an overall approach, a methodology that brings clinical expertise and applies it to massage. A very, very necessary and growing need. I've been to doctors, with my neck and over the years, and so few medical professionals are willing even to just put their hands on you. They don't even touch you. Physical therapists now are requiring a 4-year advanced training.
Doctorate.
And a doctorate to be a physical therapist. And so there's no one else other than you people who are in a position to have the skill set to, in a clinical setting, bring hands-on soft tissue manipulation that really does make a difference for so many different people. David, thank you so much for all of the years, both you and Juanita, putting together this entire package that is so comprehensive and so thorough. It's really a delight for me to have helped you to put this together. I'm very thrilled that so many students are availing the opportunity to study with you in this way.
I am too, Sam. I'm thrilled. It's a dream come true to reach so many. I've been toiling for many years, and it's a joy and a pleasure to have folks in the audience. Even though I can't see them, I know they're there, and I welcome you. I feel very much with you as a massage therapist of so many years. I understand a lot of what you're going through, and I'm sure that you understand a lot of what I've been through as well. So it's a joy and a pleasure to be in front of you speaking and interacting with you. And I'd like you to follow up this webinar with communicate with us anytime with questions or comments about the program. Make sure, Sam, that they have my phone number and my email address or any way of getting in touch with us to inquire and ask questions, because it's a program of communication for sure. So again, thank you so much, everybody.
Thank you. And thank you too for Juanita for participating with us online. Your contributions to the coursework and the daily activity on the website is integral. I think in the next webinar we'll spend the time to get your computer up and get you participating with us as well online. There's so much that you bring to the party here, and we appreciate that.
That's a fact.
Okay, thank you all very much. This will be available as a replay on demand. You'll get an email of that location shortly. You're welcome to share that, and we do hope that you'll register and join us. Coming shortly, starting November 6th, online for David Morin's Health Matters Seminars Medical Massage Therapy Masterclass. 5 months of great work that will change your massage career, enhance your earning potential, and allow you to extend your massage career using the tools and the ergonomic techniques. Okay, thanks so much for joining us. Have a great day. Aloha.